Hi, my name is Dr. Alex Schlachterman. I'm an advanced endoscopist at Thomas Jefferson University Hospital and a senior author for the paper Economic Impact and Utilization Trends of Peroral Endoscopic Myotomy and Endoscopic Submucosal Dissection.
And I'm Julietta Gervase, a medical student at Sidney Kimmel Medical College at Thomas Jefferson University and a co-author of the study. Thank you for joining us.
We were motivated to do this study because procedures like POEM and ESD have transformed care for patients with achalasia and early GI cancers. They are minimally invasive, well-studied, safe, and often allow patients to avoid major surgeries. Yet despite the advantages of these procedures, many patients still struggle to access them. Hospitals are sometimes hesitant to build programs that offer specialized therapeutic endoscopy procedures, including POEM and ESD, because their reimbursement rates are low. What our study shows is that POEM and ESD are not just clinically meaningful, patients want and need these options. Over 7 years, hundreds of patients came through our program, and remarkably, more than 40% of these patients were completely new to our health system at the time of their procedure. To us, this highlights something important. When these procedures are available, patients seek them out. They represent an access point to safe, less invasive care options that patients often can't find closer to home.
For us, the heart of this paper is not economic. It's about expanding access to the fullest range of effective treatment options and providing high-value care to patients. Across the United States, thousands of patients with achalasia and millions with early GI cancers would be potential candidates for treatment with POEM and ESD procedures. However, these procedures are still not offered at many centers, despite being well-established treatment options. As a result, patients may receive more highly invasive treatments simply because these less invasive options don't exist within their healthcare system. These patients deserve the option of minimally invasive therapies that preserve quality of life. We also see POEM and ESD as excellent examples of value-based care within gastroenterology when used in the appropriate clinical context. By offering these endoscopic approaches, health systems can ensure that patients receive the right level of intervention. For many patients with these diseases, surgery remains the best or only option. But when a less invasive approach can safely achieve the same clinical outcome, choosing a minimally invasive endoscopy procedure, like POEM or ESD, can improve patients' overall care by avoiding the added risk, longer hospital stays, recovery challenges, and financial burden that can be associated with more invasive surgeries. And importantly, offering POEM and ESD also ensures that our surgical colleagues' time and resources are directed toward patients who truly need the highest level of care and surgical interventions. To make this possible, endoscopists need support and resources from their institutions. Therapeutic endoscopy programs require specialized equipment, coordinated referral pathways, and trained personnel. When those investments are made, health systems can offer the most fitting level of intervention for each patient. Someone with early GI cancer or achalasia, who is an ideal candidate, may receive a treatment that allows them to recover sooner, preserve organ function, and continue life with fewer interruptions.
We hope our findings help reassure clinicians and health systems that offering these procedures is worthwhile, not just because of financial sustainability, but because they meaningfully expand access to care. Looking forward, we think there is a real opportunity for more centers to adopt these procedures and for policymakers to continue advocating for appropriate reimbursement and wider availability. Our patients benefit when procedures like POEM and ESD are widely available and not confined to a handful of large academic institutions.
Thank you again for taking the time to watch this author discussion and learn more about our work. We hope it contributes to expanding access to these important GI procedures and improving the care our patients receive.